Social drinking and social smoking is enjoyable and people feel happy, but it does have its own impacts on health. I'm Dr. Vanaja Reddy from Apollo Jubilee Hills, Hyderabad, and I'm a consultant psychiatrist, and I have 17 years of experience in psychiatry, and I'm a UK returned doctor. Today I'm going to speak about smoking and alcohol addiction. Smoking, which has a nicotine most of the time, it could be strong and it could be mild in the cigarettes, but this smoking to little bit extent may not cause big health issues, but once it becomes an addiction, for example, smoking a whole packet or 10 cigarettes a day or 20 cigarettes a day definitely causes health impacts. It initially causes health impact on the lungs, later on liver, and then finally to the blood vessels, heart, and then brain. But when it comes to the brain, it's quite debilitating because it disturbs the neurotransmitters and it disturbs the nervous mechanism, and it causes anxiety, depression, and when you stop smoking, it can lead to withdrawal symptoms, and it also can cause to some mental health issues like psychosis or bipolar diseases. So overall, smoking, people think that it is just a pleasurable thing to do, but it has its own impacts. So first thing, if you're mild smoker, that is 2 or 3 cigarettes a day, you can easily cut it off by yourself by weaning them off from 3 cigarettes to 2 cigarettes a day to 2 cigarettes to 1 cigarette a day, and then finally stop it. But when you're addicted to 10 cigarettes and 20 cigarettes a day, it's quite difficult to stop by yourself. So that's when you have to seek a de-addiction specialist or else a consultant psychiatrist who are going to put you into de-addiction of smoking, de-addiction of nicotine. So the initial steps usually would be cutting down on smoking right away and adding de-addictive medicines and also relaxative anti-anxiety medicines. At the same time, natural things like yoga, meditation, walking, fitness like sports also help in reforming yourself. So that is with the smoking. Now coming to alcohol, alcohol has become quite rampant in most of the populations. I've seen alcohol in small children like child and adolescents, also seen in younger adults, older adults, and also old age people. This alcohol causes main damage to the liver and then to the brain. So in the brain, what does it do in the brain? Alcohol does disturb the neurotransmitters and it does disturb the nervous system in the brain, also causes shrinking of the brain, which is ischemic changes in the brain, which is usually seen in the older population. If you are drinking alcohol, you will see the same changes in younger people as well. So what does it do? First, you forget, when you drink alcohol, you forget yourself and you don't know what you're talking, and it takes away all the inhibitions. That's the immediate effect of the alcohol. Later on, what does this alcohol do? It affects on the brain and you get memory problems, and severe alcohol drinkers have memory. Along with the memory problems, you see psychotic symptoms like seeing things although it's not there, psychotic problem. Also you get epilepsy, fits. I've seen alcohol, heavy drinkers throwing up fits and epilepsies, and then the falling off, frequent falls. That's when they have blood clots and stroke as well, and they end up in stroke and paralysis. So alcohol is a quite dangerous thing. Whether you drink in a minimal amount or a maximum amount, it does show impact in the brain. So how do you treat it? If you are able to manage by yourself, you have to cut down alcohol gradually. If you're drinking 100 ml a day or 90 ml a day, cut it down to 60 ml a day. Later on, cut it down to 30 ml a day and then stop it. But if you're a heavy drinker and binge drinker, you do have de-addiction centers, and you do have consultants help here. So consultant psychiatrist can do de-addiction on you. And also, once you are de-addicted, de-addiction medicines are given and you are off alcohol. To take away the cravings, there is a medicine which psychiatrists prescribe to get away with the cravings. Cravings is a major issue where, although you are de-addicted and there's no alcohol in the system, you have left it, sometimes the cravings can be bothering. With the cravings, you go and seek drinking again. So for that, there's another medicine, special medicine which psychiatrists prescribe. So always seek help with heavy alcohol users or heavy smoking users.